The three biggest factors that we see with dental anxiety are pain is usually number one. Past bad dental experiences are number two. And actually something we hear quite common, previous sedation trouble. When we're talking about pain, a lot of patients have had experiences where they've had dental work done, things were breaking down, they got into pain even after trying to solve that with regular dental work. And now they feel like they're between a rock and a hard place and they don't know what to do. They don't want that pain again. And that's how we start considering all on X to start over. Now, with bad previous dental experiences, we hear that all the time too. People say, you know, when I used to go to the dentist back when I was a kid, I didn't get any anesthetic, I was feeling everything, or I got a tooth pulled and the dentist was on my chest trying to get it out for like 2 hours. You hear all these stories about these other dentists that just mistreat their patients, unfortunately. And then patients come to us saying, you know, I haven't been to the dentist in 10, 15, 20 years, and you can't blame them. Who would want to go to the dentist after an experience like that? And the third thing, like I mentioned, is the sedation. That's actually something that we hear quite often where people say, I'm really worried about those other two things. Am I going to be fully out, or what is the protocol? Because I've had issues with sedation before. And that's why we don't have a specific across-the-board thing that we do for everybody, because everybody's case is so different. So for some people who have had a history of sedation trouble, we bring in an anesthesiologist, a CRNA, and do general anesthesia. They are completely out, completely. Other people who are more worried about that and just want to be in their own little happy world and then not worry about me or the procedure, any of that kind of stuff, we still do IV sedation, do moderate sedation. That way they are still awake and they're breathing on their own. It's a lot safer as well, but they don't have to worry about the procedure and the anxiety and the pain and all that.